right, we can start.
Go ahead.
Okay. Hello, Joseph. I'm Hannah. I'm your student nurse today. Can I get your name and date of birth? Mr. Jackson. Perfect. That matches. I'm just going to double check your wristband here, and it looks like you do have a saline lock going. Done a quick assessment of that, and that looks great. So Joseph, it looks like you're ordered to have some antibiotics run through your IV. Do you have any allergies at all? No. Okay.
I'm gonna do a room scan.
Perfect. All right. So prior to entering the room, I would have got the medication from the med cart. I did verify it is for the correct patient. I got one medication at a time per patient. And then I did verify that I closed and locked the med cart prior to leaving. And then now I'm just gonna do my first two checks. Come around here and open the order form. All right, so for Joseph Jackson, we have an order of sodium chloride 100 mils per hour that is paused, but it has been running. And then as far as the antibiotic, we have an order for piperacillin sodium tazobactam, 3.375 grams, IV piggyback. It is due now, and looks like it ends 11/12/2025. In my hand, I have piperacillin tazo, 3.37 grams per 50 milliliters to infuse over 30 minutes. Expiration date is 12/20/30. Second check, I have an order for piperacillin tazo, 3.375 gram, intermediate IV piggyback, scheduled for now. And it looks like order ends at 11/12/2025. I have in my hand piperacillin tazo, 3.37 grams per 50 milliliters to infuse over 30 minutes. Expiration date is 2030. And I'll do my third check after I get it all hooked up to the phone. So I've also verified that this is compatible with the normal saline as well, so there's no issues there. And then I'm just gonna go ahead and do this, and then I'll scan and do my third check. So I'm gonna perform hand hygiene again. To grab some clean gloves. And as I said before, normal saline has been paused, but I have verified that it is correct patient, correct order, correct dose, correct time. I'm just gonna restart the pump to show you that I know how to program it. So turn the pump on. Get through the maintenance notices. New patient for this purpose, yes. Med surge, yes. And I'm going to select channel A. Basic infusion. For normal saline, our order is for 100 milliliters per hour. Click the rate. And then it's 1,000 mils, so I'm gonna put in 900 mils for the VTBI. Verified that's correct, and I'm going to start that, and I'm gonna make sure that it's unclamped. And then I'm gonna watch the drip chamber to make sure that it's flowing. Perfect. Now I'm going to pause, clamp, and I'm going to get my secondary infusion set up. I got my medication, got a new bag for my tubing. I'm going to hang this. This is where I'll put the primary tubing after I get everything set up. Throw that in the garbage. All right. I'm trying to keep everything sterile. This still's capped, this is capped. I'm gonna grab my medication, take that off, throw that in the garbage. That little splash probably wouldn't happen in real life. I'm gonna take my cap off. Okay, and now I'm going to spike the bag. So pushing down firm, turning. All right, so that's spiked. I'm gonna untangle it. Make sure that the bag and the tubing is clamped shut, which it is. All right, I'm just gonna hang this so I can scrub the hub for the primary tubing for the Y port. Stickers. All right. So I'm gonna grab my alcohol prep pad. And I'm gonna scrub this hub right here for about 10 seconds, no less, using friction. 1 1000, 2 1000, 3 1000, 4 1000, 5 1000, 6 1000, 7 1000, 8 1000, 9 1000, and 10. Perfect. Now I'm going to screw this on. Okay. Now before I enter it in, I'm going to back prime and silence this first. All right. So to back prime, I'm going to keep it lower than the primary. And I'm just going to open the clamp. And you'll see the air bubbles start to flow. So that means it's back priming, getting all the air out. And there's just a little bit in there, but I think I can get that out of my own. So the chamber is filling up. Okay. Perfect. Now I'm going to put the primary lower than the secondary. All right, now I'm going to program the pump. So I'm going to go to select channel, secondary. I'm going to scroll to find piperacillin. Oops. All right, so I'm going to verify again. So this is where I'm going to do my third check. And I'll scan as well. So we have an order for piperacillin tazo, 3.375 grams, IV piggyback every 8 hours, due now, ends 11/12/2025. And that's just beeping, so I'll silence it in a second.
No, it just popped up.
Whatever. All right, scan the medication, and I'm gonna go back and just check my bag here, make sure it does say. Oops. Stop pause here. So it did expire, so I have to go back and redo it, but that's okay. All right, 3.37 grams for 50 mils. Piperacillin tazo, 3.37 grams per 50 mils to infuse over 30 minutes. That's what I'm selecting. Verify it, yes, that is the correct dose. I'm gonna press next. And then I'm gonna press start. I'm gonna make sure that's unclamped though too. Okay, and then I'm gonna keep an eye on the chamber, make sure there's a drip. Making sure that all the tubes are unclamped. It's a big drip. There we go. Perfect. So secondary has finished. I'm gonna pause, clamp it. I'm gonna clamp primary as well. And now I'm going to just take this one out. So I'm gonna go to select channel. And I'm just gonna discontinue this one here. So I can take this off the Y port. And throw this in the garbage because it's done. And now I'm gonna go back, verify that we do have normal saline. I'm just gonna put it up a little higher. All right, normal saline running at 100 milliliters per hour, and that is correct. So I'm gonna go back to my channel. I'm gonna go back to setup primary, 100 mils per hour. That's accurate. Now I'm gonna press start. We're gonna stop the secondary and infuse the primary, yes. And I forgot to unclamp it. Let's try that again. Restart. Oh, we're gonna troubleshoot, I guess. little air bubble in there, yep. Okay. Now I'm just gonna double check that it is in fact open. Okay, restart.
Boom.
All right, there we go. It's infusing. Now I will just let that run as it empties. I'm gonna take off my gloves, wash my hands, and then I'll document that I administered the piperacillin in the skill.